This is Matt Walsh with your Minute with the Mayor for Monday, June 15th. Update on the COVID spread. Over the weekend, we had 45 new cases reported. We had one additional death. The total of confirmed cases brings us to 568. Currently self-isolating at home are 237 patients. There are 7 in the hospital. 291 of the 568 have now recovered. 22 are considered non-residents. Topic today is obesity and the effects that disease has on people's susceptibility to COVID-19. We need to treat obesity not just as a disease, but as a national public health emergency. A recent study out of New York City of over 4,000 patients found that severe obesity was a major risk factor for hospitalization with COVID-19, second only to age. Obese people are more likely to have higher resistance in their airways, have lower lung volumes, and weaker respiratory muscles. These factors make an individual more likely to develop pneumonia, and they place additional stress on the heart. Obesity increases the risk of respiratory failure, alters the immune system, and may cause chronic inflammation that can rapidly escalate out of control with the coronavirus infection. I personally understand how hard it can be for some patients to adopt a healthier lifestyle because I too have struggled with obesity for years. The truth is that most patients have been told by their doctors on countless occasions that they need to lose some weight. Unfortunately, a 20-minute scolding from a too busy doctor once or twice a year isn't enough incentive to change a patient's lifestyle. Subsequently, after years of these general admonishments about needing to make adjustments in nutrition and lifestyle, the patient ends up getting diagnosed with a chronic disease. And then there is an intensive effort through various drug and exercise therapies to prevent irreversible consequences of that disease. Today, in light of the clear connection between obesity and the deadly contagions like COVID-19, we all need to do better. We have a far better chance of living longer, healthier lives if we make an appropriate lifestyle change before suffering any chronic disease consequences. Creating change this significant requires an intense, interactive doctor-patient relationship that goes beyond conventional engagement on diet and exercise. Doctors need enough quality time with their patients to help them develop lifetime health strategies with detailed interventions on how to implement these strategies. With obesity, the key is early intervention. Getting back to normal is not enough. One of the best things we can do to prepare for the next pandemic is to prevent chronic disease before it starts. The time to get our country's obesity epidemic under control is now. That's your Minute with the Mayor. Have a good week.